Welcome to Healthcare Authority's presentation on Apple Health and the Public Health Emergency Unwind, Part 1. The topics for the PHE Unwind Part 1 presentation are the following: an overview on the public health emergency, Apple Health renewals, how renewals are done through the Washington Health Plan Finder, renewals through the Department of Social and Health Services, outreach, how to apply for Apple Health, and finally, resources. The Public Health Emergency Overview. In response to the COVID-19 PHE and under the provisions of the Families First Coronavirus Response Act, the Healthcare Authority and the Department of Social and Health Services have maintained coverage for individuals when the public health emergency was declared in March of 2020. Coverage was to remain active unless individuals requested closure of their coverage, were not a Washington state resident, did not meet citizenship or immigration status, or passed away. In December, the Consolidated Appropriations Act was passed. This bill separates the continuous enrollment requirement from the PHE effective March 31, 2023. Healthcare Authority, along with the Department of Social and Health Services, are resuming normal operations starting on April 1, 2023. The federal public health emergency is set to expire May 11, 2023. For more information about the Health and Human Services letter to the governor, we have provided a link on the slide. Apple Health renewals. During the PHE, Healthcare Authority and the Department of Social and Health Services continued to attempt to renew coverage. Terminations were paused for individuals for not renewing their existing coverage, and instead, coverage was extended by 3 months at a time. Starting in April, the renewal process will begin gradually, with the first set of renewals beginning for clients with their renewal date of May 31, 2023. Most of the Apple Health programs are renewed at least once every 12 months, except for Apple Health Medically Spend Down. At application, the individual can choose to have a renewal base period of 3 or 6 months. The Alien Emergency Medical Program is specific to the period of time to cover the emergency need only. After pregnancy coverage may offer up to 12 months of coverage as long as the individual applies the month after their pregnancy end date and found to be eligible. Individuals turning 19 or 65 within the next 12 months, individuals receiving supplemental security income, and children in foster care or receiving adoption support. Individuals terminated from Apple Health may be considered for other coverage options, such as qualified health plans with financial help to lower their premiums, Medicare during their special enrollment period. Those who are employed where their employer offers health insurance would qualify them to enroll outside of the enrollment period and should contact their Human Resources Office, and classic Apple Health or long-term services and supports through the Department of Social and Health Services. Renewals in Washington Health Plan Finder. Those who should apply for coverage or renew their coverage through the Washington Health Plan Finder are mostly children, adults 18 to 64 without Medicare, pregnant individuals now or in the last 12 months, parents and caretaker relatives, and Washington Health Plan Finder attempts to automatically renew an individual's coverage 60 days prior to the end of their renewal end date. When an application is determined eligible for an automatic renewal, the individual will be renewed for a new certification period, receive a pre-populated notification that summarizes their account, household composition, tax filing status, and other information related to the application. The individual should review the notification for any incorrect information. To report changes, the options are online, over the phone, or by returning the signed form via mail or fax. If there are no changes, then no action is required. This is a sample of the letter that individuals will receive if they have not taken action to their case by the 10th of the month. The letter will provide the action that needs to be taken, a due date, contact information, and how to complete the action. If the system is not able to automatically renew the coverage for individuals, a pre-populated letter will be sent out entitled Response Required Apple Health Renewal. This means the individual must take action and renew their coverage to avoid closure. This letter is a sample where a response is required and the person must take action by July 31st, 2023 to avoid closure of their Apple Health coverage. The letter provides 4 options on how the individual can complete the action required, as well as a phone number to call. The first set of individuals who will go through the renewal process have a certification end date of May 31st, 2023. Depending on when they take action, their coverage can end as early as April 30th. If the individual does nothing, the system will send them a termination letter on May 10th, and if no action is taken, coverage will end May 31st. Again, individuals have 90 days from the day their coverage ends to complete a renewal and have their coverage reopened if they are determined eligible. This letter is what individuals will receive if they have not taken action to their case by the 10th of the month. The letter will provide the action that needs to be taken, a due date, contact information, and how to complete the action. The month before a tax dependent turns 19 years old, the system will attempt to automatically renew Apple Health coverage. If they meet all other eligibility requirements, including household income, tax dependents of the primary applicant will be renewed to Apple Health for adults. Adult tax dependents can still apply on their own if they choose. Individuals who are 19 years old or older and are not the spouse or tax dependent of the primary applicant must still apply on their own. This is a sample of the letter for individuals who turned 65 or became eligible for Medicare. A specialized letter will go out in April, May, and June, providing next steps on coverage. They have the option to be considered for other Apple Health coverage by applying through the Department of Social and Health Services and/or enroll in Medicare. Some clients lost coverage in Washington Health Plan Finder and could not be reinstated in the system. Their coverage was extended in ProviderOne. Healthcare authority staff will mail the clients a pre-populated renewal form and process the cases for individuals who turned 19 and their immigration status did not qualify them for ongoing Apple Health, or received 12 months postpartum coverage and their immigration status does not qualify them for ongoing Apple Health. This redetermination process will occur between May 2023 and April 2024. The due date for the form is the 5th of the following month. Healthcare authority staff will review the case to determine if the client responded. If no response is received, staff will manually send a termination notice from Washington Health Plan Finder with at least 10 days notice, and ProviderOne coverage will end at the end of the month. If response is received, staff will redetermine ongoing eligibility and send applicable eligibility notices. This may include a termination notice from Washington Health Plan Finder with at least 10 days notice, and ProviderOne coverage will end the end of the month. We have updated our envelopes that will read "Open immediately, action required" in red writing and written in Spanish as well. DSHS renewals. Individuals who are on Classic Apple Health that is administered through the Department of Social and Health Services are individuals who are age 65 and older, with a disability or blindness, or eligible for Medicare. This includes Medicare savings programs, health care for workers with disabilities. Renewals with the Department of Social and Health Services are also called eligibility reviews. An eligibility review form will be mailed on April 12, 2023 for those whose coverage is scheduled to end on May 31st. If by May 21st they have not completed and returned their eligibility review form, a letter will be sent that coverage will close May 31st. Those who are on Classic Apple Health will receive a letter from the Department of Social and Health Services as sampled here. It will also list which DSHS office mailed them the letter, what action is required, the due date, what information is needed, and a contact information. Here is another sample letter from Home and Community Services and Developmental Disabilities Administration, who are within the Department of Social and Health Services. Again, the letter will provide what is needed, by when, and a contact number to reach out to. Apple Health Outreach. As a reminder, now is the time for those who are on Apple Health to report a change to receive information as early as April through June of 2024, letting the individual know when it will be time for them to renew their coverage and transition to other coverage if they are not eligible for an Apple Health program. For those of you who are visual and to capture what the process looks like, clients will receive a postcard 80 days reminding them to update their contact information. 60 days prior to the end of their certification end date, they will receive a letter indicating their coverage has been renewed or they need to take action to avoid termination of their coverage. 50 days prior, the managed care plans will begin their member outreach. 20 days if no action is done, a letter will be sent out informing the individual that if they do not renew their coverage will end. 15 days prior to the end of the certification end date, text messages will be sent to individuals as a final attempt to get them to renew their coverage. And after Apple Health coverage is closed, clients still have up to 90 days to complete and submit their renewal form to be considered for Apple Health. For those who are on Classic Apple Health, again, 80 days prior to the end of their certification period, they will receive a postcard reminding them to update their contact information so that they do not miss out on any important letters. 45 days prior, individuals will be mailed a letter with an eligibility review form asking them to complete and return. 45 days prior to the end of their certification period, the managed care organizations will start their outreach campaign. 15 days prior to the end of their certification period, a text and phone call will be made as a reminder to renew their coverage. 10 days prior to the end of their certification period, a letter will be sent that termination of their coverage will occur if no action is taken. Healthcare Authority and the Department of Social and Health Services recognize individuals may not have updated their contact information. Receiving this postcard is a great indicator for individuals to be on the lookout for renewal actions the following month. One postcard goes out to clients getting coverage through Washington Health Plan Finder, and a similar version to clients getting coverage through the Department of Social and Health Services Community Services Division. Postcards will be translated into these languages: Spanish, Vietnamese, Somali, Russian, Laotian, Korean, Chinese, and Cambodian. Individuals may also report their updated information through their managed care organization. This is a sample of the postcard reminding individuals how they can update their contact information if they have had any changes. As seen here, they can update their information through their managed care organization or by logging into the Washington Health Plan Finder, by phone, or by emailing the Ask Medicaid email address. Those who are on Classic Apple Health will receive a postcard with information on how they can update their information through Washington Connections or by email or by calling the Apple Health customer service phone number. Help clients update their contact information by having this link available. It provides information on when to report a change, the types of changes to report, and how to report the change. As part of our PHE Unwind campaign, Healthcare Authority created a graphic. This graphic is for temporary use and may be used now through 1 year after the end of the PHE. This graphic is intended to create visual recognition for Apple Health Medicaid clients and stakeholders for PHE Unwind communications. More information about how to use this graphic can be found in the end of the PHE Communication Toolkit. For those of you who are interested in helping us spread the word, become an Apple Health Ambassador. It is a volunteer effort to help raise awareness and share messaging to individuals and community partners, and to help strengthen community engagement. If interested, please contact us at ahLH-COVID-19@hca.wa.gov. We also have a dedicated webpage for the ambassadors at hca.wa.gov/ambassadors. As mentioned earlier, the 5 managed care organizations will be conducting their own outreach activities to ensure their members continue to be insured. Each managed care plan will have the ability to report to Healthcare Authority updated contact information they receive directly from their member. If the individual is no longer eligible for Apple Health, the managed care plan may do outreach to connect the individual to other coverage, such as a qualified health plan. Early last year, the Healthcare Authority published an external guide and communications toolkit. The guide provides detailed information on unwinding activities. Healthcare Authority has a version 2 of the guide that was released on March 10, 2023. And for more information on this, go to hca.wa.gov/PHE. Apply for Apple Health. For adults who are ages 19 to 64, children, parents or caretakers, pregnant individuals, or those who are within their 12-month postpartum period have several ways to apply for coverage. They can apply online through the Washington Health Plan Finder. They can download the WellPlan Finder mobile app, call the Washington Health Plan Finder Customer Support Center mail a paper application, or ask for an in-person health benefit exchange navigator to assist. For individuals who are 65 years or older, have a blindness or disability, or need long-term services and supports, may qualify for Classic Apple Health coverage and may apply through Washington Connections, submit a paper application, request an application by calling, or go to a local DSHS office and apply in person. Resources. Be sure to register if you're not already for the Apple Health and PHE Unwind Part 2, scheduled for Thursday, March 23rd from 10 a.m. to 11 a.m. Topics include Apple Health programs, post-eligibility reviews, scenarios, and more resources. Here is a list of resources on the PHE Unwinding Communications Toolkit, an email address for Apple Health eligibility and COVID-19 questions, and Healthcare Authorities Reference Guide. Here are resources on information on enrollment data by county, how to send your application for MAGI Apple Health or Classic, our stakeholder training and education webpage, and the policy representatives throughout the state of Washington. Thank you.